You strain your low back, one of the reasons could be your QL or quadratus lumborum. Keep watching to find out how to fix it. The quadratus lumborum is one of your main back muscles, and it travels from the iliac crest to the TVPs or transverse processes of your lumbar vertebrae 1 to 5, and it attaches to your false rib or your 12th rib. This muscle is responsible for extension when they contract on both sides at the same time, and lateral flexion if just the one side is contracting. So it goes without saying that if you strain this muscle, which is, by the way, another word used to describe a muscle tear, it hurts to do any of those types of actions or to do any of the opposite actions. Now, the reason why this can cause pain while you're doing any of the actions that it is responsible for is that when you have a strained muscle, contracting a strained muscle just hurts. That kind of makes sense, right? Likewise, if you take a strained muscle, which is again a muscle that has a mild tear in it, and then you stretch it out, that would also cause some pain in the muscle. So we're going to go over some exercises on what to do during your early stage rehab and mid and late stage rehab as well. The early stage rehab, when we're going to deal with this muscle, has to do with symptom management. And this is because the intensity of pain can be a little bit too high, and it can make a lot of movements feel intolerable. So the point of the early phase rehab exercises that we're going to be doing today is to just really promote some tissue recovery via getting the muscle to lightly contract within a tolerable range, and that will help with some increased circulation and blood flow to the muscles that are involved. The QL, when it's in myospasm, can cause some referral pain into the hip and pelvis, even though you have no issues with the hip and pelvis in itself. And this can be kind of confusing for a lot of people because they'll be doing exercises for the hip and pelvis and it won't improve at all, and it's because the pain is actually coming from the quadratus lumborum. QL strains can last anywhere between 2 to 6 weeks depending on the grade of the strain, with grade 1 strains lasting closer to the 2 to 3 week period, and grade 2 strains lasting up to 6 weeks. Grade 3 strains refer to complete tears of the muscle, and that's pretty uncommon in this type of muscle unless you're in a serious accident. Now, if you're wondering why your QL got strained in the first place, there are actually a lot of different reasons. Often the most common reasons are unprepared movement, fatigue buildup, stress, and deconditioning of the muscle. So these types of issues tend to be multifactorial. There usually isn't a single factor. Usually it's a buildup where the muscle's deconditioned, you did something that you're not used to, and you happen to be tired or stressed during that time. That's usually the kind of perfect storm that causes this muscle to get strained. All right, so next we're going to move on to our week 1 exercises. These are the exercises that you do in the acute phase of healing. This is really good to do when you're actually finding yourself way too sensitive to movement. So let's get started right now. Now, the first exercise that we'll be doing is to just get a little bit of movement into this muscle. And this is going to help with reducing any type of spasming that might be happening in the muscle. When you're doing this exercise, it's also really important that you're sticking within a tolerable range. So this is a pain-free movement. If that means that you're not really moving much during the exercise, that's okay. We're going to work with what you got. So first we're going to do is put a yoga mat on the floor, and then we're going to lie down on your back. From here, you're going to go in what we call crook lie position, which is where your knees are bent, feet are flat on the floor. You're going to bring your thighs together so that they're touching. From here, hands on the side to just support your pelvis. You're just going to rotate your hips to one side as far as you can. So generally speaking, in this first week of rehab, you're probably not going to be able to get all the way down to the floor like I am right now. You're probably only going to get about halfway before the pain starts, and then from there, you're just going to come back up to the middle. But instead of rushing through this movement, we're going to use diaphragmatic breathing to help the muscles relax in that position. So first we're going to come to the side, you're going to go as far as you can, and while you're there, just take a nice, big, relaxing breath. And as you exhale, you're just going to return back to neutral. And we're going to actually alternate sides. So next we're going to go to the other side. And return back to normal. You're going to keep alternating sides, and you're going to feel a slight stretch within this low back region and even within the abdominal wall as well. And then we're going to go to the other side. And you're going to continue repeating this for about 10 reps on each side. You'll be doing this exercise about once daily. And this is, again, to just make sure you're mobilizing those low back muscles. The worst thing you can do for this type of situation is not move at all. So if you are thinking about just sitting on the couch or being in bed all day, trust me, that's going to delay your recovery. And you want to actually make sure you're mobilizing these tissues at least a little bit, because what we want to do at this point is to maintain mobility and promote circulation or blood flow. The next exercise we're going to do is going to be an activation exercise. In this exercise, we're not going to do much of a movement at all. So next, we're going to lie down on your back. feet on the ground, and you're going to have your hands just on your chest right now. From here, all you're going to do is take your right shoulder and rotate it into the ground, assuming the strain is happening on your right side. If it's your left side, then you take your left shoulder and you rotate it into the ground. But because the ground is blocking your movement, you're actually not going to see much movement. So right now I'm going to rotate my right shoulder into the ground, and I'm going to feel these muscles on my low back contract. And then I'm going to hold that contraction for up to 7 seconds, and then I'm going to relax. Now this is an effort-based exercise, which means you're going to push as hard as you can tolerate, but you're not going to push through pain with this exercise. So if that means you could barely push at all, that's okay. That's all you got. That's what we're working with today. So we're going to go again. We're going to do about 5 repetitions in total. So we're going to contract again, pushing my right shoulder into the ground. You're not really seeing me move, but I'm trying to rotate my spine into the ground. And then I'm going to relax. And in between, you're going to rest for about 7 seconds as well. So you're going to do a 1-to-1 work to rest ratio. We're going to go again, pushing down, making sure you're breathing. Don't strain your breath. You don't want to hold your breath during this exercise, and relax. And we're just going to do 2 more together. Now what you should be feeling is these muscles, the area that you're experiencing some pain, you should feel that area activate, but it shouldn't hurt. So I'm going to push one more time, rotating into the floor. Make sure I'm breathing. Now I'm able to push pretty hard because I'm uninjured, and relax. And we're going to do 1 more. So this is an exercise that you can do throughout your whole entire rehab journey when it comes to recovering from the QL strain, last one, because it is effort-based. But generally speaking, once you can tolerate a little bit more movement, and relax. I like to actually do exercises that are a little bit more dynamic. Okay, next we're going to be standing up, and we're going to need a wall. So from here, we're going to find a nice cleared area against the wall. And we're going to do what's called a side plank, but we're going to do it on an incline on that wall. And again, we're going to target the side that is strained. So if I injured my right side, then I'm going to put my right arm on the wall. So what you're going to do is you're going to take your forearm, you're going to support it against the wall. From here, you're going to make sure the arm is elevated to about shoulder height. You don't have to be super strict with it. You're going to then take a few steps away from the wall so that you're on a bit of an incline here. And you're just going to hold this position for as long as, for about 30 seconds. And you're going to do it within a pain-free rep range. So you're going to hold it for 30 seconds. And if that feels good, then you could go a little bit further. Now, if you go a little bit further, your arm's going to be a little bit higher relative to your the rest of your torso, but that's okay. You're going to just keep it in place. And from here, you're going to hold that again. So you're going to go as far as you can really go, up to the point where you pretty much can't support yourself. So you could go up to about a 45-degree angle and just support yourself, and you're going to hold that for up to 30 seconds. You're just going, again, just feel the muscles contract. You're not going to push through pain with this type of exercise. And you're going to hold that, make sure you're breathing. And you can do about 3 repetitions once a day during this early stage rehab process. All right, so next we're going to go on to the exercises that you're going to do starting week 2, 3, and 4. These exercises are going to be about utilizing these muscles through movement and kind of getting your QL to contract and to move your spine. All right, so let's get started with those exercises. During this stage of recovery, what we want to focus is on 2 different things. We're going to work on generating strength through movement, and then we're going to also work on generating strength to resist movement. So we're going to first start with the resisting one. So we're going to do an exercise that is anti-rotation. So it's going to get your core, your obliques to engage alongside with your QL muscle so that you're not just overtaxing your QL in isolation when you're doing some of these movements. So we're going to get a band. I'm using a monster band here rated from 15 to 25 pounds, but if you have any band, you could use it as long as it's anchored at about hip height, okay? So from here, I have it anchored on something super solid, and I'm just going to walk away enough so that there's some tension here. Now, the great thing about doing banded exercises is that you can moderate how intense this exercise is just by standing closer or further away from the anchor point. From here, I'm going to just grab it with both hands, and I'm going to hinge forwards, keeping my back nice and neutral until my hands are about knee height here, okay? So from there, I'm going to pull the band in. This is the rest position because there's less of a lever arm resisting against me. And then I'm going to make sure I breathe out, bring the band out. I'm going to hold this position for up to 10 seconds here. And I'm going to feel my QL resisting as the band's pulling me this way. I'm going to be pulling up against that. And then I'm coming back in. And we're going to repeat this for about 6 repetitions. So we're doing about 1 minute of holding all together. And then when you rest, you can rest up to 5 seconds. So kind of like a 2-to-1 work ratio. Now I'm not injured, so I don't really need much of a rest. So I'm just going to go right back into it. And we're going to be doing this for about 2 sets, okay? So we want at least 2 working sets in the second week of rehab. In your 3rd or 4th week, you could bump it up to 3 sets. And you're gonna come back in and then back out like that. Now that we've done about 2 sets and 6 repetitions of this exercise, we're going to move on to now our dynamic strengthening exercise called the rotational row. So we're going to be starting in this half kneel position with the band anchored at standing hip height. So right now I'm going to have the band with a slight amount of tension while my arm is outstretched at roughly chest to shoulder height. From here, I'm going to simultaneously bend my elbow to pull the band back, okay? And I'm trying to keep this elbow relatively to shoulder height. And while I'm doing that, I'm actually going to rotate my torso all the way to the right. Now I'm doing this on the right side. Again, I'm imagining I have this right-sided injury. If it's on your left side, just do it the opposite direction. From here, I'm going to pull the band towards my chest. I'm going to rotate at the same time. I'm going to feel these external oblique muscles, my internal oblique muscles, my QL activate. I'm going to hold that contraction for up to 2 to 4 seconds, whatever you can tolerate, and then coming back in. And then what I want to make sure is I'm actually exhaling when I'm pulling back and then inhaling as I'm relaxing. And we're going to do anywhere between 10 to 15 repetitions of this exercise. Now, it's really important that while you're doing this exercise, you're actually trying to rotate the spine so that you can actually get that QL to activate. I know we mentioned that the QL is responsible for back extension as well as side flexion, but when you combine those 2 motions together, it produces a rotational movement, which is why we're doing these rotational based exercises so that we can actually produce results in both extension and lateral flexion. And then coming back in. So for this exercise, again, if you're in week 2 of your rehab process, you're going to be doing 10 to 15 reps, and you're going to be doing about 2 sets. On your week 3 or week 4, you'll be doing 3 sets instead. You could also make this exercise harder by just starting at a more tense point, so starting a little further away, or by just using a heavier band, so a stronger or thicker band to add just more resistance. Okay, so with that said, we're going to do our final exercise. Now, this exercise will require a bit of a setup. You will need access to something like a pull-up bar. So if you have access to a gym or if you have a home attachment, it'll be really useful for this next one. Let's go over to our pull-up bar. All right, so what we're going to do is we're actually going to go into a dead hang position on the pull-up bar, and then we're going to do what's called a QL pendulum. So I'll show you what that looks like. You're going to see it from my back angle so you can see what's going on. So from here, I'm going to just go into that dead hang. And your legs can be straight or they can be bent. It really just depends on how much space you have in your home. I'm going to bend my knees. And from here, you're just going to lift the pelvis to one side. And I'm going to feel all these muscles, the QL, some of my oblique muscles, some of my lateral erectors, contract and engage. And I'm going to hold that end range for about 5 seconds and then coming back down. And again, I'm going to the right because in this theoretical injury, I injured my right side. And I'm going to hold that and then coming back down. Now, since we're doing isometric holds, we're only going to do about 5 to 6 repetitions, 5-second holds, and you could rest for about 5 seconds. So we're going to be doing a work to rest ratio of 1:1. It's really important that you guys and girls take advantage of that rest because it's going to allow you to do higher quality repetitions, and that's what we're after right now. And that will require some recovery between repetitions. Great. All right, so the common theme for these exercises is that if it's your week 2 of your rehab program, then you're going to be doing 2 sets. Week 3, 3 sets, and then week 4, we're also going to do 3 sets as well. Now, if your pain persists for longer than 4 weeks, then chances are it might be a 6-week recovery period for you. And if it lasts longer than that, it's really important that you see someone for your programming. You want to see a healthcare professional to make sure that you're actually doing the right thing. Sometimes if you're chasing the wrong problem, things won't really improve. Now, if you're in Toronto or Markham, you could visit us at Rehab Hero. You could book in with our clinic. You can see a physiotherapist or chiropractor or massage therapist. All these professionals can help you with your pain. Now, when it comes to resting between sets, you want to do at least a minute to a minute and a half of rest. And you want to really make sure you're keeping yourself accountable by using an actual timer. The problem is that some people will mentally feel like they can go at it again, but the fatigue is still built up in their tissues and they won't be able to do as many high quality reps. And that's what we're after. We want those high quality repetitions so that we can stimulate a good recovery. Now, another common question I usually get is, do you have to do this on both sides? Now, while you are injured and the injury is only on one side, the answer to this question is no, you don't have to do it on both sides. But I would always say, might as well do the other side while your injured side is resting. And this will help you feel a little bit more even following the completion of all your exercises. All right, so that wraps up our video for today. If you have any questions, let me know in the comments below. If you haven't subscribed to my channel yet, please hit that button. I'll see you all next time. Peace.